My name is Lisa Peterson, and I will be presenting this gate check meeting for Group 5. We decided to go with a project based on the emergency room wait time and finding a way to reduce it. Our entire group is made up of healthcare administration majors, and so we decided, let me blow that up bigger for you. We decided to go with projects that were relatable to our future careers. Here you can see we had emergency room improvement plan, a scholarship application program project, and a therapy for clinical therapy add-on for a waiting room. Down here, the scores, you can see the emergency plan had the highest weighted score, and that was the plan that we decided would have the best criteria to follow and would be a valuable project to look into. Here is a chart that shows the average emergency department waiting time based on treatment or urgency of the patient care. For the immediate care, which is about 2% of visits, it's 28.9 minutes, whereas for the urgent care, which is for 41% of the visits, it's higher here at 63.3. We decided to take on the task of finding ways to reduce the wait time in emergency rooms in order to improve patient satisfaction and care and help the provider feel less stress. One way that makes this interesting for our project is that because we are healthcare administration majors, it's going to be more of a very thorough report and researched to see if these ideas that we've come up with will indeed decrease waiting room times. For the need and the opportunity, if you look at this chart, these are the average ER waiting times across the United States. And on this end, we see that Maryland, Maine, New York is in here. They have very high waiting times. This one is about 54. Whereas over here in the smaller populated states, Montana, Idaho, Colorado, they have lower waiting room times. We feel like there's a significant need to find ways to reduce the waiting room times over the entire country. If we can come up with a plan that can be implemented into an ER setting to reduce the wait time, we feel like this would help increase revenues for the facility by generating more patients through, as well as making patients more satisfied with their care, not having to wait so long, and improving the overall experience of the ER. The average waiting time of all of these states is about 30 minutes. The scope you can see in this flow chart over here. We started with our idea and the functionality of it. We gathered the needed data. Dinged.